STDs remain a public health challenge during the COVID-19 pandemic. The impact of disruptions in care and testing are yet to be determined, as 2020 data shows that some STDs have decreased while others continue to increase. Newly released 2020 data from the Minnesota Department of Health, or MDH, show that some sexually transmitted diseases and HIV rates in Minnesota have decreased slightly during the pandemic, while others have continued to increase. Health officials say that the numbers in the 2020 report reflect some uncertainty due to pandemic-driven reduction in services and testing that may have affected reported cases of sexually transmitted diseases. The annual HIV STD data report released today showed that HIV and STDs overall in Minnesota have declined by 2%, yet gonorrhea rates have increased 27%. The report also notes a special concern with an increase in cases related to two distinct HIV outbreaks in the Twin Cities metro area as well as the Duluth area. The disruptions in preventative care during the COVID-19 pandemic meant fewer STD testing opportunities in 2020. This was explained by Christine Jones, who is the STD, HIV, and TB section manager for MDH. She urged Minnesotans to take advantage of the resources that are once again more available. Christine Jones commented, "This is concerning, especially as MDH and other organizations respond to two HIV outbreaks within the state. It is incredibly important that people seek preventative care and testing now in 2021. The HIV outbreaks in the Twin Cities and Duluth area are really highlighting a rise in overlapping issues among people who inject drugs and people who are unhoused. MDH remains committed to supporting community-focused efforts to address these issues." Here are some key findings by the numbers. Data from 2020 shows that STDs remained at very high levels, with 33,252 STD cases reported last year, compared to the 33,725 cases in 2019, a 1% decrease. Chlamydia remained at the top reported STD in the state with 21,942 cases. That number reflects an 11% decrease in cases reported to 24,453 in 2019. This is the first time chlamydia rates have decreased since 2009. But with testing and services disrupted by the pandemic, it's not clear whether it represents a true decline of that magnitude. Gonorrhea has remained the second most reported STD in Minnesota, with 10,214 cases reported in 2020, which is a 27% increase. Syphilis cases overall have decreased 3%, with 1,093 cases in 2020. Despite the overall decline in all syphilis stages, the early, more symptomatic stages have increased 8% from 2019 to 2020. As for HIV and AIDS, the number of newly diagnosed HIV infections reported to MDH decreased 18%, with 226 cases reported in 2020, compared to 276 in 2019. People assigned male sex at birth account for the increasing majority of HIV cases at 84%. Over 2/3 or 69% of new HIV cases disproportionately affect communities of color. The estimated number of people living with HIV and AIDS in Minnesota is 9,422. Syphilis outbreak moves to a sustained increase. MDH's response to the syphilis outbreak in both Cass and Beltrami counties continued through 2020. The outbreak was reclassified as a sustained increase of cases in 2021 as a result of changing syphilis trends. Data indicates that the number of new cases is leveling off. However, syphilis continues to impact these counties and remains a critical concern. Testing, monitoring, and outreach continues statewide. Providers should also stay vigilant about screening for congenital syphilis, as 7 cases were reported in infants in 2020, which is a 66% decrease from 2019. An HIV outbreak was declared in both Hennepin and Ramsey counties in 2021, with cases dating back to 2018. Another outbreak was declared in Duluth in 2021, with cases dating back to 2019. Minnesota's outbreak-associated cases have risk factors consistent with national outbreaks. New infections in the outbreaks are primarily affecting people who use injection drugs or share needles and works, people experiencing homelessness or unstable housing, men who have sex with men, people who exchange sex for income or other needed items. MDH Medical Director and State Epidemiologist Ruth Linfield has mentioned that there are ways to prevent HIV include consistent use of condoms and a daily pill to prevent HIV, often called PrEP. It is also really important to get tested regularly for HIV and STDs. And if you are diagnosed with HIV, you must stay and take your treatment to make levels of the virus undetectable. This is so essential because people living with HIV who are taking their medications and have undetectable viral load do not pass HIV through sex. MDH funds community-based programs that provide STD and HIV services and prevention resources throughout Minnesota. These programs offer prevention education, testing services, and support for people who need care and sterile syringe access. For more information, as well as the complete Minnesota 2020 surveillance reports for STDs and HIV, this can be found at the MDH website underneath STD statistics.